एज अ मेडिकल स्टूडेंट अगर आपको लग रहा है कि यू आर फाइंडिंग इट डिफिकल्ट टू टेक हिस्ट्री एंड दैट इज बिकॉज यू डू नॉट हैव इनफ नॉलेज, well, you're not alone. Think again, you might not also be right about it. But understand, history taking, first of all, is a skill. It is not necessarily about the knowledge domain. Skills require practice. So, one of the reasons students struggle with history taking is because there isn't enough practice, and looking at videos or apps and reading books is not going to help you directly in history taking mastery. So, first of all, go to the wards, talk to people, talk to patients. That's how you start developing the skill. Secondly, while theory is important, you need to know the topics, but you have to remember that learning happens both ways. That means if you take the right history, you learn while taking the history, and if you have learned theory topics, you would take better history. So, history taking helps in theory, and theory helps in history. You'll have to start somewhere, and if you ask me where do I start, I'll always say start with the history. Now, why is that going to help? Well, because that will keep you thinking. There are two things that will help you in history taking. One is good communication skills. If you learn how to speak, you'll do good. But second is good analytical skills. That means on the go, you have to train your mind how to ask a next relevant question. It should not be a checklist of 10 questions that I went and asked, but it should be a logical question that follows the symptom or the sign that you see during history taking and examination. So think about it, and the best next step for you after you have heard this video is make a schedule of how and when you're going to go to the ward, take a case and present it. Make mistakes and you learn on the go. This is your time to do that. Best of luck.